seniors and individuals over the age of 60, and even some folks with disabilities across the nation. Let me introduce Christina Orton. She is our director of the Aging Program, which includes Older Americans Act. Christina has been with us for several years now, and we very much appreciate, at KDADS, she's been with the Aging Program for probably about a year now, Christina, and we very much appreciate her willingness to learn all there is to learn about the Older Americans Act. Also, Cynthia Harris is our Senior Care Act Program Manager, and then Gabrielle is our nutritionist, our dietitian. In addition, we have Commissioner Amy Penrod on the call today, so we're all looking very forward to hearing your feedback. That's what this listening tour is about, is us hearing your comments, your perspectives, your insights as far as how the Older Americans Act services work well now and how we could improve upon or modify the delivery systems now or our policies to better serve seniors and folks with disabilities. So with that said, again, we can't thank you enough for joining us, and we look forward to hearing your feedback. Go ahead, Christina.
Thank you, Janice. In case everybody didn't hear it or see it, we are currently recording this session so that hopefully we will be able to post that to our website for others to view at a later date. So I just wanted to make sure that everybody understood that. So there's a red little dot, and that's the recording dot that popped up. Thank you, Janice. So as Janice mentioned, my name is Christina Orton. I'm the Aging Services Director for KDADS. She mentioned Gabrielle and Cynthia are also on this call. I do realize it may confuse people because Gabrielle is actually using Ann Yakeley's Webex account for this event. So if you see Ann Yakeley, it's really actually Gabrielle. We would like to take the time to thank you for being here today. This is a listening session for the State Plan on Aging. It is conducted to gather your thoughts on services provided by KDADS Older Americans Act program, referred to as OAA. This event means a great deal for the state because it allows seniors to voice their needs and allow us and the Aging Network to develop goals to better serve older Kansans. Before we get started with the presentation, we have brief information we'd like to go over, such as some housekeeping notes. At this time, all participants are muted. Gabrielle and Cynthia will do their best to ensure everyone stays muted. However, we ask that you assist us with this by making sure you stay muted. To provide comments, give me 1 second. To provide comments, individuals with computer access may raise your hand by going to your name in the participation list. Individuals with computer access may also type your name and county of residence in the chat area. We will address the individuals joining on the computer first, allowing time for individuals on the phone to share towards the end. As you can see on the screen, KDADS' mission. If you would wish to follow along at a later date, if you do not have computer access, there is a PowerPoint presentation located on the KDADS website, which is this exact presentation. There's one from last session as well as this session. We'd like to start our presentation by sharing our mission here at KDADS. Our mission is to protect Kansas, promote recovery, and support self-sufficiency. We achieve our mission through major program areas such as home and community-based services, long-term care, behavioral health services, state hospitals, and nutrition services. These programs provide a wide range of services such as Aging and Disability Resource Center, ADRC, Older Americans Act, OAA, Senior Care Act, SCA, Medicare programs, such as Senior Health Insurance Counseling for Kansas, called SHIC, Senior Medicare Patrol, SMP, Medicare Improvements for Patients and Providers Act, MIPA, Client Assessment Referral and Evaluation, CARE, and Programs for All-Inclusive Care for the Elderly, PACE. A little background information on OAA. It was originally signed into law in 1965 and established the Aging Network, which provides community, social, and nutrition services for older persons and their caregivers. Since 1965, there have been many reauthorizations of the Act, including the recent 2020 reauthorization through 2024. The Older Americans Act funds services that keep older adults healthy and independent in their homes. In accordance with the Older Americans Act of 1965, as mentioned, KDADS, as a designated state unit on aging, submits a state plan on aging to the U.S. Administration on Aging every 4 years. This plan describes the agency's vision and purpose, including the goals and strategies to achieve this vision. Development of the plan is accomplished through interaction with the Kansas Aging Network. The Older Americans Act is the most comprehensive legislation composed by the 7 titles. KDADS administers the grants for OAA Title III and OAA Title VII. The Title III are grants for state and community programs such as supportive services, including homemaker, attendant care, transportation, case management, legal assistance, etc. Nutrition, which is Title IIIC, congregate and home delivered meals, nutrition education. Disease prevention and health promotion, Title IIID, evidence-based health promotion and disease prevention programs, and family caregiver support. Title IIIE is respite, counseling, information, support groups, homemaker, etc. Title VII are the grants for the elder rights protection, such as long-term care ombudsman's programs, prevention of elder abuse, neglect, and exploitation, and state legal assistance development programs. The purpose of our plan on aging is to outline the primary responsibilities of planning, policy development, administration, coordination, priority setting, and evaluation of all state activities related to the objectives of the Older Americans Act. The Kansas Aging Network shall serve as an effective and visible advocate for older individuals by reviewing and commenting upon all the state plans, budgets, and policies which affect older individuals, and provide technical assistance to any agency, organization, association, or individual representing the needs of the older individuals. The Kansas Aging Network shall also assure that preference will be given to providing services to older individuals with the greatest economic needs and older individuals with the greatest social need, with particular attention to low-income older individuals, including low-income minority older individuals with limited English proficiency, and older individuals residing in rural areas. The slide here shows all the area agencies on aging throughout the state of Kansas. To meet the needs of the older Kansans, KDADS administers programs throughout the state, primarily through local area agencies on aging. The Kansas Association of Area Agencies on Aging and Disabilities, also known as K4AD, represents all 11 area agencies on aging, which we tend to refer to as AAA, that coordinate services, access, provide information, case management, and numerous other services for seniors in all of the 105 counties in Kansas. To learn more about these services offered, you may dial the number on this screen, which is 1-855-200-2372. The Older Americans Act plays an important role in the lives of older Kansans, with services and programs provided through the 11 AAAs, 3 tribal organizations, 165 Title III service providers, and hundreds of invaluable volunteers. In 2019, nearly 33,000 older Kansans were served through OAA Title III registered services such as congregate meals, case management, personal care, home-delivered meals, and homemaker. Providers in Kansas provided more than 3.1 million meals, 20,000 rides, and 10,000 hours of personal care to older Kansans. The National Family Caregiver Support Program hosted more than 1,000 counseling and training events and served more than 13,000 family caregivers with more than 35,000 hours of respite care to provide much-needed relief. Lastly, the Kansas Long-Term Care Ombudsman's Office provided more than 1,000 consultations to help resolve complaints and issues on behalf of individuals residing in a long-term care setting through OAA. Please know the State Plan on Aging is intended to address seniors' current and future needs related to the OAA services. We acknowledge that the coronavirus pandemic is top of mind for many. However, the intent of the listening session is to gather input and unmet needs prior to the start of the pandemic. Your participation will be used to develop the upcoming 2022 through 2025 State Plan on Aging. Please take the opportunity to share suggestions, needs, comments, and feedback about OAA and the aging services. Soon you will have the opportunity to provide feedback over the phone or over the computer. If you do not have a chance to speak today, please consider joining a future listening session or submitting written comments. Some questions to consider. What Older Americans Act services are working well? Are there gaps in the Older Americans Act and other aging services? What is the most important for you to see in a program serving seniors? What are barriers to services? Social isolation and loneliness are prevalent, and these issues have been exacerbated by the COVID-19 pandemic. How can the Aging Network address social isolation and loneliness? Please feel free to share this opportunity to provide valuable feedback with your families and friends. Written comments will be accepted through April 30th, 2021. You may send these comments via email to kdadsOAASCA@ks.gov or by mail to the attention of Christina Orton, Aging Services Director at 503 South Kansas Avenue, Topeka, Kansas, 66603. KDADS will be hosting 2 additional listening tours from 10:30 to 11:30 on Monday, November 9th and Wednesday, December 9th. Please stay tuned and feel free to follow us on Facebook to learn more about the upcoming events and information regarding the 2020 listening tour. We will now be moving into the Q&A portion of the call. However, this is an opportunity to provide open-ended feedback, comments, and success stories regarding OAA aging services in Kansas. The purpose is not necessarily to answer questions, but to provide an opportunity for public comment and to assess for unmet needs for older Kansans. At this time, we will go ahead and move into any questions or comments or success stories. And Gabrielle and Cynthia are going to help us with that portion.
Yeah, so as Christina mentioned, there are several ways to share feedback. So if you're on the phone, we will provide an opportunity to unmute you towards the end if you would like to share. If you're on the computer, you can either send your comment in the chat box, or if you would like to share and have your line unmuted, just send your name and where you live, the county in Kansas that you live, in the chat box as well. You can share that way. Not seeing anything in the chat box yet from any attendees.
Gabrielle, can you actually give us an idea of who's on the phone, at least by organization? Do you have the organizations who are on the phone?
It just says call-in user.
Okay. So do you want to just maybe open up the callers so that they can speak up? How do you want to do that, Gabrielle?
I'm seeing, we can do that in a bit. I am seeing a question in the chat box from on the computer. The question is, will the state provide a direct line of contact for people who are on hospice and who need Medicaid, especially for long-term? This is from Carrie Thompson and Raylan McClelland.
Thank you for that feedback. Go ahead, Janice.
Yeah, Carrie and Raylene, you might just talk to us a little bit more about that as far as individuals who are on hospice that the organization is familiar with, but they may need assistance with Medicaid, or you might just talk to us just a little bit more about that if you don't mind. Do we open up Carrie or Raylene and see if they want to just talk to that a little bit more, speak to that a little bit more, Gabrielle?
Yeah, I can unmute them.
Okay. Unmute them for just a moment. We'll see.
So Carrie and Raylan, your line is open if you would like to elaborate on the question posted in the chat.
Good morning. Are you able to hear me?
Yes.
Wonderful. So the question goes to, when working with PACE participants in the past, there was a team designated specifically for a Medicaid renewal or application, for example. What I'm seeing as a hospice social worker is that while the applications do get turned around, a lot of times, because it goes into a general area, the fax goes to a general area, I don't have a direct line of contact with anybody to facilitate giving people what they need for care in terms of long-term care, as I once did for people on PACE. So I guess what I'm asking is, there could be consideration, or if there is consideration, for people who need Medicaid, are on hospice, to have a team designated for them through the state for consideration for Medicaid application.
Carrie, that's a good question. Let us make a note of that, Christina, and we could follow up with you directly once we get we do have a PACE manager position posted, I believe, so if we can follow up with her, Christina, specific to that request. Carrie, it would be helpful when you visit with our new program person one-on-one, just to share the history of what did that look like and tell us how that worked, and then that will give us some insight as to whether or not that process could be replicated. But Christina, can we make sure we make a note of that?
Yes. I appreciate the feedback.
Yeah.
It's very helpful.
Okay, I'm seeing another question in the chat, kind of a general. Good morning. Will there be written information mailed to seniors who would like to provide comments and ideas? From Heidi Pickrell.
Heidi, Christina, feel free to chime in, but Heidi, at this juncture, I don't know that we were going to mail anything directly to seniors who would like to provide comment. We were hoping that we would have some seniors on the call today, and they'd be willing to share their ideas with us. If you have suggestions on how we would get more information from seniors directly, let us know, whether that means we provide information through our senior centers or what that might look like. Be sure and share that with us, Heidi, and Christine and her team can talk about how else we might ensure we get information to seniors. I will share with you, I think, Christina, there have been meetings with the Area Agency on Aging directors, I hope, on this process and how we get feedback for the state plan service. Definitely we can continue to work with AAAs, Heidi, but we'd be willing to hear from you also, as Christine and her team.
Sorry, Janice, go ahead.
Go ahead, Christina. No, go ahead.
I was just going to say we are initiating a survey that we plan to release hopefully November 1st that we will send out to all of our stakeholders. So that would include PACE, and we're hoping that you guys can help us reach those out to consumers or participants that are being served in the state of Kansas.
Good.
And Heidi in the chat says, very good, thank you. Okay, I mean, what I can do to access the people on the phone is go ahead and unmute all lines. I realize there's some danger in doing that, but if I unmute all lines and people would like to share that are just on the phone, not joining from the computer, that will be your opportunity. And still throughout, please feel free to send stuff in the chat.
Gabrielle, maybe you could open everyone up, and then you could just do a quick roll call by phone number and just ask folks as you scroll down through the phone numbers if they'd like to provide, if they have questions or input.
Unfortunately, I cannot see phone numbers either. It just says call-in user and number, and if you're just calling on the phone, I don't think you would even know what your number is.
Okay. Well,
so the other option is if you're on the phone and you do have a comment, if you push *6, that will unmute you.
Yeah, *6 will unmute. Just in case that isn't working, I'm just going to see what happens when we unmute all, and then if it's too much, we can remute. That sounds good? Okay.
Yeah, and then everybody can mute themselves also.
Correct. Yeah, so mute and unmute on the phone is *6. The lines are open.
Does anybody have any questions or feedback that they would like to provide? We also like to hear success stories. So if anybody would be willing to share some of those, we would appreciate that.
Or even brag to us about what you've done in your nutrition program. Jamie, it's good to see you. Jamie Gideon, so thanks for joining us. If anybody wants to speak up and just brag about what you've done during COVID-19 with your nutrition program. I've got to say we cannot thank you enough for what you've done to modify your service delivery system to accommodate COVID. Christina mentioned earlier that, we'd like to hear from you as far as what's gone well prior to COVID, but we also recognize that there may be new opportunities as a result of COVID to incorporate more telehealth, for example, more electronic communication as opposed to face-to-face counseling, for example. So if you have something you'd like to share with us of what you're really proud of as a result of responding to COVID, we would love to hear from you. And we don't mind silence. We'll be happy to wait for just as long as we need to. If you want to share something with us, please do. Well, let me just ask you this. Let me just see if I can get someone. Share with us the most significant barriers you've experienced as a result of COVID. Maybe if we start there, we'll get some feedback on what's happening out there. It will be helpful for us to hear from you all.
This is Jamie Gideon from the Alzheimer's Association.
Hi, Jamie.
Hi. One thing, mostly it's a comment, maybe a question too, but one of the things that we're hearing quite a bit about, and it's mentioned on the slide here, but is the social isolation that obviously during COVID times has been quite a bit exacerbated, and we're seeing a lot of people, especially those that have Alzheimer's or a form of dementia, that have been struggling because obviously some of them are not even aware of what is happening with COVID. Obviously for quite a while, visitation was restricted for obvious reasons, and that's starting to open back up. But what are your comments kind of on how that's going, of what you're seeing with visitation and different long-term care communities opening up, and anything regarding the isolation part of it?
Yeah. So, Jamie, thanks for that. There will be a visitation guidance posted on our website. In fact, maybe it was posted on Friday. Scott Bruner, our Deputy Secretary over Facilities and Hospitals, along with Lacey Hunter, our Commissioner over Survey and CERT, have spent quite a lot of time with CMS and KDADS and long-term care facility providers. So we have been talking to the nursing facility folks along with assisted living and Home Plus and residential health care, just to gain a better understanding of what we can do in Kansas to open up the facilities to visitation with caution. So CMS in September did provide new guidance indicating that facilities need to open up, but the reopening is driven based on positivity rates by county. So the facilities are working closely with their local health departments and their health officer in the county to open up slowly with person-centered plans, if you will, so that visitation can be accommodated but mitigate as much risk as possible. So it has been quite a challenge for 700 plus adult care homes to determine how best to open up for our 30,000 residents and facilities across the state. So, Jamie, we do believe that the guidance that was published last week will help better explain and help help folks understand, the public and the facilities and the residents, as to how the reopening can happen, but it will be a county by county process, if you will. So it's going to be laborious as far as working through this COVID-19 pandemic as it continues. And as you have heard, I'm sure, there is concern that as winter approaches, we may even be more challenged. So we appreciate the question, Jamie. Review that guidance. Let us know what you think. It has been a difficult time. We agree completely.
Thank you.
So what are folks, do we have some nutrition providers on the phone? What are you hearing from your customers specific to isolation, and what is your sense? How are seniors faring? I don't want to shift gears that this call becomes a COVID-19 conversation, but I do think it's important for us to make sure we understand how seniors are faring out there, and then what we can learn from COVID as we write our state plan for the next 4 years.
Janice, this is Cynthia. I have a comment in the chat. Can you hear me?
Yes.
This is from Midland Care, Tim. And he said one of the biggest barriers to serving participants in the home is denying access into their homes. This is due to their fear or exposure of the virus. They're isolating themselves and foregoing certain care out of fear. This neglect of routine care causes them to decline quicker and require a greater amount of care.
We would agree with you, Tim. Feel free to chime in, the rest of the KDADS team or anyone else. We would agree with you. We would agree. I mean, we would agree with you completely. You know, we've also heard that seniors are postponing going to see even their doctors. Seniors may not be as familiar with how to use technology to stay connected with their physicians. And we would agree that there's just a lot of fear out there and what the virus may mean for individuals. And we agree, they are isolating themselves. The one thing I might mention in nursing facilities, if I can go back to Jamie's question for just a minute, and I don't know, Tim, how this might be working for you at Midland, but in nursing facilities, CMS did require states to initiate a communication devices opportunity for facilities to purchase tablets and not laptops as much, but tablets and other type of devices so that they could connect with caregivers at home via Zoom or Webex or FaceTime, whatever it might look like. So that particular system has been in place for a while now, that seniors do have the opportunity in nursing facilities to connect. We also experimented with that option in our community-based side, and I think Dan Goodman in Johnson County and Annette Graham in Central Plains also bought some communication devices to try to help community-based seniors stay connected to their long-term care loved one. I don't know how much we've actually seen our community-based partners support individuals who are in their homes to stay connected when it comes to telehealth and telemedicine. So, Tim, it might be something that at some point in time we'd like to just visit with the PACE providers. Christina, you might make a note of that if there's more that could be done with our PACE providers when it comes to telehealth or telemedicine. I'm not sure what's going on with PACE at the national level with telehealth, but it certainly seems like it would be something we could consider. And maybe, Tim, you all are doing that. But definitely something that we'd like to hear from you. We'd like to hear from you. I have difficulty getting them to answer their phones. Oh, dear. Sorry, Christina, I didn't mean to, or Cynthia. There was a chat from Mary Hebert. I have difficulty getting them to answer their phones. Oh, my. So, Mary, tell us more about that. They're not answering their phones at all? Mary, you can feel free to just speak up or chat, whichever you prefer. Mary, it looks like you're typing, so we'll be patient. Oh. Cynthia, did you see that chat box? They often don't answer phone numbers they don't immediately recognize. Working from home increases the problem. Oh. Good insight, Mary. So you're telling us that if you're working from home, because you're working from home, if seniors don't recognize your phone number, then they may not answer the phone. So,
I imagine that's a lot related to a lot of the scams that happen over the phone.
Yeah.
Fear of being scammed.
Yeah. Well, let us say that we very much appreciate that feedback, and I don't know, certainly I don't know for sure, Amy, what we could do to speak specifically to reach out to seniors. I'm not sure what we could do, but Mary, please let us know if you have suggestions and ideas, and we'll continue to brainstorm. I am trying to, sorry, Cynthia.
Oh, that's okay.
You go ahead and read it out loud, Cynthia.
Oh, yeah. She was trying to unmute. She said, at Midland, we use a variety of technology to communicate with participants. We have telehealth, plus we have devices called grandpads, which are tablets that are more user-friendly for older adults. These devices allow us to video conference with our participants. We have been successful with seeing our participants either in person or via telehealth. It just takes trust with the provider that they will be safe.
Very good. Christina, let's make a note of that, and maybe you and Cynthia and Gabrielle can work with Kara and on our PIO at KDADS and make sure that we share what Midland is doing with some of our other providers. I don't know what the nutrition providers are doing. I think that AAAs are probably engaged in some of this same type of activity, but let's follow up, Gabrielle, with our AAAs. And well, Leslie's on the phone. Maybe Leslie knows. Leslie Anderson knows if the AAAs are familiar with grandpads and what that looks like and what they might be doing. So thank you for sharing that. That's good to know.
Thanks.
This is Leslie. Hold on. Can you hear me?
Yep.
Okay.
Yeah.
I think some AAAs are, probably more than not. I think with all of the flexibilities in the telehealth right now, we've all become more knowledgeable in those types of technology devices and services.
Yeah.
And Annette is supposed to be on here, so she might have some specific to the Central Plains AAA.
Good. Well, we certainly understand that it's difficult during this difficult time to focus on our delivery system without talking about COVID. It may just simply be impossible, actually, to have these kind of opportunities and not talk about COVID and what's happening across our nation and happening in Kansas. So we very much appreciate your feedback and your insight, and we will do some brainstorming internally based on your chat discussions and our open phone lines to see, you know, what we can do. It certainly helps me to hear from you all directly just how isolated seniors might be feeling, even those seniors that trust us and know us but may not recognize a phone number because we're working from home. I appreciate that insight. So that's good to know. You all probably know we've been working at home from KDADS since March, and we may still be at home for a while. So it's good insight that as we work from home, there's even more concern for seniors if they don't recognize the phone number. So that's good. Appreciate that insight, Mary. So and others. Well, what else? What else do we need to talk about today? Christina, I don't know how long you are scheduled to keep the call open.
Oh, scheduled till 11:30, so we have about 10 more minutes or 11, depends on what clock you're looking at. And if you, even since we have people on here, if you could provide feedback about this Webex meeting, we would appreciate that too. Or if you'd like to do that at a later date, reach out to us to let us know what worked, what didn't work. That way we can try to make it better for the November 9th meeting. We would appreciate that as well.
Well, let me ask this, Christina, just to confirm that the WebEx technology in general, Annette, if you're on the phone, Annette Grant, well, we heard from Jamie. I think Jamie called in. I'm not sure if Jamie was call-in or if she was using her computer. Yeah, Jamie was call-in, and it did work. So we know that the phone line did open up and that people could visit. Okay. Well, Christina, if we don't have more, then I'll let you wrap up, or we can wrap up and say thanks to everyone. And I agree with Christina. If you could give us your feedback on this particular WebEx technology itself. We are using Microsoft's Teams product. at KDADS, so we don't use Webex much anymore, but Webex has a couple of features that we felt were more conducive to the ADA. So we chose to use ADA compliance, I should say, so we chose to use Webex today. So we would appreciate hearing from you, and I agree with Christina. We'll continue to learn this particular technology until some additional options become available under Teams. So.
Yep, I just want to take the time to tell everybody thank you for joining us today. Like we mentioned, we do have 2 more sessions, so November 9th and December 9th from 10:30 to 11:30. All that information is on our KDADS website, so along with the transcription notes from the last meeting we had, and hopefully soon the video from this meeting. We also if you follow KDADS on Facebook, you can go out there. KDADS has created events for the upcoming sessions. If you're not a follower of KDADS, go out there and hit the like button and follow KDADS, and then you will see the events. Other than that, I thank everybody for coming out here and joining us, but we will go ahead and end a few minutes early. Again, thank you, and feel free to send any written comments. We appreciate it, any feedback.
Thanks,
everyone. You guys have a good day.